To all our viewers. I would like to correct my title. I'm a professor of public health in
Okay.
School of Medicine, Cairo University. And I'm very glad to get the news from the Ministry of Health from Dr. Amr Andil. He's the head of the preventative sector, announcing that we have reached more than 100 million vaccinations
Yes.
for the COVID-19. We have half of them almost took the first dose, and we have 37 million who took the second dose, and we have a variety of others taking the boosters. So this actually reflects how far alert the Ministry of Health for facing the uprise in the COVID cases. And it also expresses our preparedness to face the situation with more preparedness and hands-on for our field activities of the current vaccination.
Yes, Dr. Shawky, Dr. Maysa Shawky, Professor of Public Health, Cairo University. Dr. Shawky, now the number, how do you see this number, 100 million doses and 917,000 doses of coronavirus virus that have been given to citizens so far? How do you see this achievement by the Ministry of Health and the Egyptian state?
Well, you see, the Ministry of Health has lots of active portfolios going hand in hand together. The overpopulation portfolio, the improvement of healthcare delivery, the improvement of coverage, and the delivery of the primary healthcare component with all its preventative aspects. We're all the time seeing that there are lots of activities going together hand in hand, and that one of these activities is the full alertness for the COVID situation, and the making the vaccines available and reaching out for the community to vaccinate them reflects how active the Ministry of Health is and how determined it is to reach its targets.
Yes. During the coronavirus that started 2020 in the year 2020. How do you see Egypt's performance concerning this challenge? And especially, I would like you to shed light on an important point, which is that all the medicines were available through these years. The people were not suffering from any shortage of medicine concerning the coronavirus or something like that. If you could shed light on this, please.
Well, I would say that Egypt, the Ministry of Health and Population, and even the Ministerial Board altogether, headed by His Excellency Dr. Mustafa Madbouni, they were all working in a strong network, making everything available for the Ministry of Health and reaching out for the people through other ministries as well, like Ministry of Higher Education, Ministry of Education, and even Ministry of Youth. We probed several routes to reach for the people, fully fledged, reaching even to the distant governorates and to the rural communities. What was outstanding in this fight is that the Ministry of Health has a strong network for delivery of healthcare, and we have a central hospital in each governorate, and we also have a fever hospital and an isolation hospital in each governorate. And this made the containment of the spreading of the disease and the facilities for the sick people to receive the appropriate treatment much better as compared to other countries.
Yes, the role the track that the state have taken since the coronavirus pandemic started in the year 2020 by spreading awareness through all channels, through the papers, through the social media, through the TV programs. Everywhere the people now are very aware of what to do and how to deal with any symptoms. How do you see this? And we can see that in Egypt, people are now making a kind of adaptation. You know, they are taking good care of their family and themselves. So how do you see this, the echo that was left behind, the efforts exerted by the government and the Ministry of Health that resulted in the citizens now being aware of what to do and the right track to take?
Well, I would like to echo upon that. It's the forced social marketing campaign that has been repercussing upon the people's head since then about the preventative measures for the COVID and the hygienic measures in particular of hand washing and disinfection and even spacing and avoiding the crowded places and seeking help whenever possible. This message has been multiply bombarded for the people to the extent that they know it off by heart right now.
Yes.
And did succeed in making it easy for the people to choose how to protect themselves and to make these measures possible on the personal and the family basis.
Yes. So, Dr. Shawky, the number now that we have of 100,917,000 shots or vaccines being provided to citizens. So, does this cover the first shot, the second shot, and there is also a third shot? Could you explain more, please?
So far the report has said we have 50 million have received at least one dose, and we have 37 million at least received the second dose, and we have like 13 million have received multiple boosters. And this in itself is a very good rate for coverage, and is going to make us reach what we call the herd immunity, and this was one of the targets for earlier, is to reach a herd immunity where most of the people are either vaccinated or got the disease. Now we have 100 million at least have been vaccinated, and we definitely have records for cases who caught the disease. But at the end of the day, we are looking for what we call the herd immunity. And this herd immunity is going to bring about a virus that is very weak to circulate in the community, and we can bend away its fatality.
Yes. So, Dr. Shawky, what is your assessment of the decline of the corona infection in Egypt?
Well, this decline is favored by number one, the vaccination, because this is the best and the strongest preventative measure, and the people getting to know more about how to protect themselves and their families, either through hand washing or disinfection and spacing. So the two things go hand in hand to bring about positive health in the population.
Yes. The citizens of Egypt abiding by all the rules and the instructions that the state have provided them through all channels, through social media, through papers, through programs, through news bulletins. What does this show of the Egyptians? And also, what is the result of this in providing help for the citizens and the good communication between the citizens and the government?
Well, this is an ongoing dialogue that has started early in January 2020, where people started to know more about the virus, and they started to see in the community real sick cases, and then they started to hear about the preventative measures in a concentrated form, maybe at their work, in their schools, in universities, in the media. And then when people started to take their vaccinations, they started to feel like a little bit more secure. And they found out that implementing the preventative measures is not that much difficult. It needs a change in attitude and behavior. And families started to find out that when they abide by the rules, they are more and more protected. So we are right now reaping the investment in the health awareness more fruitfully. And we are achieving by the universal vaccinations a better level of protection. And we are aiming for, or we are targeting to reach the herd immunity all over the country.
Yes, now recently, nowadays, Egypt is going through a very cold weather. So what's your advice for taking good care of ourselves and the methods of prevention?
Well, we are going to revise the methods of prevention for the COVID. We ask the people to keep themselves away from crowded places, to keep on their masks all the time, so long they are in a crowded place, and to wash their hands or disinfect their hands as much as they could, and to eat healthy and nutritious food, especially so for the greens, for the green vegetables, because the chlorophyll in the green vegetables is very protective. And we ask the people not to gain weight and to keep moving, keep their activity log quite active, because this also encourages a better immune system.
Yes. My last question, Dr. Shawky. Egypt have started providing the vaccine of the tuberculosis or the TB since 1924. Was this also a reason for providing a kind of immunity for most of the Egyptians since the coronavirus started?
No. The vaccination for the TB is being there on the scheduled vaccination for children in the first 18 months. It's a routine here in Egypt, and it is not routine in European countries. We have it here as a routine in our work, and some research has found that there is sort of a cross immunity between TB vaccination and the COVID, but it didn't reach to up to scientific evidence, real scientific evidence.
Yes, I thank you very much for your time. Thank you for your valuable information, Dr. Maysa Shawky, Professor of Public Health, Cairo University. Thank you very much for joining us over the phone. And with this, my dear viewers, we come to the end of this episode of our program, Cairo Local Time. My name is Amal Mukhtar. Thank you for watching.